Hi, hello. My name is Dr. Sethu Wariyar, and I'm a pediatrician who works in the field of neurodisability and its rehabilitation. I do look after children who have varying kind of disabilities, and autism happens to be one of them. As we know that this is the Autism Awareness Month, we have decided to launch a project towards ensuring that the people out there in the world come to know a little bit more about autism than they knew before. Because autism has been a sort of a hidden disability that many people do not even recognize that it's in them or in the people around them. And it often takes a very long time for it to be unraveled. And by the time most of them suffer a lot of problems, emotional issues, mental health issues, including depression and anxiety. So let's talk about autism. My view about autism is that it has got two sides to it, and on one side you have the socio-communication aspect, where a person with autism, whether it's the most severe form or the most lightest form, both of them have difficulties in engaging in a two-way dialogue in a more reciprocal manner, so that they could use those words to express the emotions, and hence very often relationships are affected in them. So to establish a relationship, one needs to have the resources and the tools to express oneself using facial expressions, gestures and body language and words to express what your thoughts are and what your emotions are, and also to understand the other person's thoughts and emotions so as to reciprocate it in a more effective manner and then get into a sort of a relationship. Now on the other side, we have also same people suffering from difficulties with having these rigid, inflexible ways of thinking that makes their interests very restricted, or they find it difficult to change the pattern of their behavior or daily routine or anything that they are accustomed to, because they love perseverance of sameness. They love to have the same scene, same food, same clothes, day out, and it can be a bit overbearing for parents to stick on to those routines when changes are inevitable. So that is one issue that we see them as struggling with the challenge in being more flexible to our thoughts, words and actions. They have very restricted interests, so it might be just the television program called Thomas the Tank Engine or various video games. Most commonly we see children who play certain games are more prone to have autism than other games. I'm not naming them. Now the other point that has been much recently added on is the hypersensitivity or hyposensitivity to certain stimuli, which could be touch, smell, taste or any of them. And we know that some kids, even otherwise without autism itself, can be very susceptible to loud noises, and they can start to get startled or later on start to cry when they hear loud noises. But in children with autism, it is completely unexpected when someone goes to the toilet or bathroom and opens the hand dryer, switches it on, or any such noises that are sort of common household noises, and that can evoke a very severe emotional response to it, or they find certain tastes very strong, or they find certain colors or any of those special senses intolerable to bear. And when it becomes that intolerable, it is very difficult to get them back to their normal state. So any of these changes or changes in routine or difficulties with the sensory stimuli coming in the way, whenever they face it, they feel that the world is hostile to them, and as a result they react back to it in a very strange manner. It could be called either fight and flight response, or they go for the freeze response, as many people know, and that is what is the root cause for many of the secondary behavioral problems that they develop as a result of these rigid, inflexible ways of thinking and ways of behaving. I think that summarizes what autism is. So we have a socio-communication issue where a child finds it difficult to have a clear two-way dialogue using words that evoke emotions, and hence they fail in relationship. And on the other hand, they also have a difficulty in being very rigid, very inflexible, and carry on doing repetitively certain words, certain objects, certain topics, or certain actions, which might be called stereotypies. And that what stands out in them from the others is the way how they repeatedly use it, to the extent that it can be found quite disturbing for the people around them. So, putting it all together, autism is actually, if you look around, there are millions of people out there who have autism. Not all have been diagnosed with autistic spectrum disorder. Many of them are still in that stage where one could just call it a trait. But when it becomes a disorder, when it affects their daily living, when it affects their learning or engaging in a social relationship, it emerges. In the sense, one never can fulfill those domains, and as a result, they do become outliers to the normal world. So, autism is something that could be very easily caught, very easily diagnosed, very easily managed, to the extent that if caught in right time, made a diagnosis in right time, and the appropriate support is given, you will have a perfectly normal child with a perfectly normal life, without having so many hurdles of anxieties to jump past. And every parent's duty is to find your child's skills, talents, virtues, and nurture them, and to find ways to go around the problems that comes their way. Thank you.